Hello everyone, and welcome to the second instalment of my mini-series on the effect of caffeine on our overall health and well-being. This one is going to concentrate on our digestive function and how that can become compromised by caffeine, and I hope that some of you might have seen my previous video which introduced the stress response, as this will follow on from there. So what we were talking about there is that caffeine can cause this survival mechanism to be triggered. And that means that our body diverts resources away from other bodily functions that we would normally just, the way that we live, towards keeping us alive. And one of those things that it compromises is our ability to digest. Because if you are just thinking about staying alive, you aren't thinking about sitting down to a nice meal and then digesting that well and utilising all those wonderful nutrients. So if we start at the beginning, when you eat something, it travels down your esophagus and it enters the stomach. The stomach should be this nice big bubbling, boiling pot of very strong acid, which is there to break down your food and then allow it to travel into the intestines where it can be further digested and absorbed properly. So if we have this stress response, our ability to produce that very strong acid is compromised. So what we get is we get food going down into the stomach where it's held for too long, because the very tight ring of muscle at the base of our stomach is pH dependent, i.e. we have to reach a very strong acidic state for that to open and then the food to travel down into the intestines. So when that food is sitting there, what people tend to get is a feeling of fullness after meals. They almost feel like they have a brick in their tummy and it's very uncomfortable. They may also feel nauseous or be sort of burpy, which again is very unpleasant. The other common thing that people get is heartburn or acid reflux, because although we're saying that stomach acid isn't strong enough, it's still pretty strong. So if there's food there and it's being forced back up and it's splashing against the base of the esophagus, that's when we get irritation and that very characteristic pain and indigestion style feeling. The other thing to note is that the stomach acid is actually a protective mechanism. It's part of our immune systems, because our sort of gut is our exposure to the outside world. So things like bacteria, viruses and parasites might enter into our bodies with our food, but if they hit that very strong acid, they should be killed off and we should be fine. However, if our stomach acid isn't strong enough and they're hanging around for too long, we become more susceptible to infection. We have compromised our immune systems. So if we talk about when that sort of ring of muscle at the base of the stomach, the sphincter, does open and the food travels down, we have a couple of things that have kind of gone wrong so far. One of them is that a lot of our minerals need to be ionized. They need to be chemically changed by the acidic environment of the stomach for us to be able to absorb and utilize them properly. So if we haven't done that as effectively as we should have done, we aren't going to gain the maximum amount of nutrients from our food. The other thing is the food won't be broken down into small enough pieces, so we get larger particles of food travelling down into the intestines, where we then get our normal bacteria feeding on them and we get excessive amounts of gas produced. Now the bacteria there are very important. They again are a part of our immune system. They help to make vitamins, they help to break things down. They are vital for our survival. But they'll have a party. If you give them a really big chunk of something, they will go to town, and that's when we get abdominal cramping. Maybe we don't get good sort of bowel motility, so we fluctuate between diarrhea and constipation, and that gas, that sort of unpleasant, quite smelly gas sometimes that people can suffer from. That's because the bacteria in our intestines aren't quite as balanced as they should be. So somebody might say to me when they come in, hold on, you're talking about how this is compromising my digestive function and how all this is going wrong, but actually if I have a coffee in the morning, I will go to the toilet like clockwork. The thing there is that in the long term, you're not doing yourself any favours, because what's actually happening is coffee is a gastric irritant. So at the moment, it is making you go to the toilet because it's going along and it's causing spasming of the intestinal muscles, and it's making the lining of your tummy very sore and causing everything just to come away very quickly. What we know is that over a long time, if we do this, we get intestinal inflammation, which can cause a whole host of other problems, and we get lazy bowel muscles developing because they don't need to work properly, because every now and again you just shock them full of coffee, they squeeze very tightly and everything rushes away. So actually what we want to do is we want to move away from that state. We want to very much think about calming down that stress response, and we very much want to be thinking about retraining our intestinal muscles to work effectively on their own. So I have a couple of top tips for doing this. For those intestinal muscles, the thing I like to use the most are flax seeds. You take 1 to 2 tablespoons of whole flax seeds, pop them into a small glass and cover them with about 250 millilitres of water. You then want to leave them to soak for sort of 8 hours-ish or sort of throughout the day, and then drink them just before you go to bed. And what you'll notice is there's the whole seeds and they've also formed a bit of a gel. That gel is very soothing, it acts to lubricate the intestines. It will also help to soften the stool and help it to pass more easily. And then as a double-edged sword, you've got those little seeds that travel along and they tickle and stimulate those intestinal muscles, making them work more effectively. So that's a brilliant one to use and can be used for quite a long period of time for people. The other thing to think about is your magnesium levels, and this is why I always recommend people to use Epsom salt baths, because what that does is it's an osmotic laxative. It helps to draw fluid into the bowel. So that's what we want to do, and that will help to soften the stool and again make sure that we pass complete bowel motions. Now, this is not to say that all digestive problems are going to be down to caffeine, but there's definitely a link between having too much caffeine, too much coffee, being too stressed and not digesting properly. I would 100% suggest that if you are having really big problems that you talk to somebody individually. If you have any other questions, as always, please directly message me or put a comment underneath and I will come back to you as soon as I can.